Good morning, everyone. It's my honor and privilege to participate in Asian Wound Care Association conference and third Global Wound Care. I would like to thank Professor Hari Krishna for what he's doing for the whole region and all over the world as well. So today I will present diabetic foot prevention in hospital setting. My name is Gulnaz Tariq, and I'm here today to share with you my experience, what I have done in my hospital setting. I don't have anything to disclose or conflict of interest with this presentation. So the learning objective of my talk is to reflect on knowledge and experience which we will gain. Consider how best to use new knowledge in practice and employ strategies, techniques to improve foot health of people with diabetes and ruminate about future possibilities. Let's just review the stats. As you know, 15% of people with diabetes develop a foot ulcer. Recurrence rate for neuropathic ulceration is up to 66%, and 12 to 14% require an amputation, whereas 50% of amputees require a contralateral amputation within 5 years. So up to 60% have peripheral neuropathy and up to 40% have peripheral vascular disease. And when we talk about survival rate after diabetic foot ulcer, you can see that 80% will have survival rate in 1 year, whereas 69% in 3 years and 29% 5 years survival rate. And ischemic heart disease will be the leading cause of death in people with diabetic foot ulcer. This was the paper published by David Armstrong, and you can see the 5-year mortality rates for amputation is 47% and neuropathic ulcer is 45%, which is higher than the prostate cancer and breast cancer. So it's quite alarming that the mortality rate is this much higher, and we really have to join our forces, join hands to work on how we can work on prevention for these diabetic population so they will not have these mortality rates or amputations in the future. The problem with diabetic foot problem for our area or our region is late presentation. Why late presentation? Because lack of education, lack of understanding and awareness about the disease, undiagnosed diabetes, loss of employment due to comorbidities, and the fear of hospital setting or fear of healthcare professionals, and then the financial cost of treatment. The lack of education, understanding, undiagnosed diabetes, all these things is a financial problem. And then this fear will make them not to come to hospital setting. And then the fear of amputation, that they will lose their limb if they will approach to the healthcare facility. So that's the fear for combining all these things, which are making them coming on time to the hospital setting and approaching to the right facility or right institution where they can be, treated or prevent these type of problems which comes on their way. So what can we do? What can we do is to teach them, to educate them on a different levels. So that education has to start from, I should say, from schools. We need to consider the policymaker, government institution, that has to be, part of the program, because the prevalence of diabetes is really very high in some of the region and all over the world as well. Revascularization, timely revascularization for microvascular problems is one of the key for this population who suffered with these kind of problem, and then they don't realize until was damage is being done into their feet. So we need to act now. If we don't act now and to focusing on prevention programs, prevention strategies, it will be quite late. And then what happened in our, areas or the countries or the worldwide is patient will lose more limbs into with this problem, and then having no awareness of how often they should go and check their feet with the institution where they know what needs to be done. Then the effective wound care for this kind of ulcers is also another key for saving their limbs or treating it on a timely manner or timely fashion. Effective infection management of this kind of ulcers is also very important when it comes to that you have to treat these ulcers on a very timely manner. Otherwise, the septicemia and then it will spread all over the body then or the limb. It will be very hard to save it. So early detection and control of septicemia or infection also plays a major role. Then we need to educate the patient what will be the consequences if if we don't treat them on a timely manner, so they might lose the limb. And then the effective of offloading of this population for the ulcers which they are having, and considering mobility of the patient, supporting devices, contralateral limb preservation, and all this can really play important role. Offloading, of course, but the sad truth is this is what the people think or the patient think is the proper, or like some of them don't have awareness of how important it is to have proper footwear rather than traditional or footwear which is not really suitable for them. The other important factor which I want to highlight is offloading. Due to cultural issues or the environment or the weather. So this offloading and all these things comes with the education. So we need to educate the client how important it is, or educate the patient how important it is that we need to offload your feet from this ulcer, so then the ulcer will heal and then your limb will be saved. And then we need to educate them in various institution and region, the cultural footwear what they're wearing, regardless of whichever country it is. But we need to teach them the proper footwear importance and how important it is for this population to have footwear which is really good for them and not to make any extensive damage of what they have already into their feet. These are some of the examples, and then the change of practice from cultural footwear to proper footwear help with the help of the team, especially the podiatrist and vascular surgeon, and the team approach to teach them with the help of wound care nurses. It's a very small thing, but when it comes to outcome, it's really massive outcome. You can see with this population that once they understand it, they talk to other, and then the other and the other. So that become a chain of education for this population who is suffering with diabetes, and teaching them how important it is to have this modalities or to have offloading or to use proper footwear can really make a difference and then save the amputation on the right time. These are some of the patients we were dealing with, and I'm showing you picture not to make you frightened, but just to give you that we also have the same problem what any other institution or facility can have in their respective area. But then the problem is global. We need to join hands together to see and build up a team, so then we can really make a difference into patients' life. So early identification, proper management, teaching of the patient, care pathways to determine who is low risk, high risk, and diabetic foot emergency. So the access has to be fast according to the risk of these population. Then we can act on a timely manner to save their limbs from amputation. So this is one of the study which we have done in our institution, and I'm sharing this with you. We started this program in 2010, and you can see when we started, we have screened around 960 patients, and the 960 patient was having improper footwear, which was quite a challenge. And then 530 patients out of 960 was having calluses, but they were not aware what this callus can damage and what extent the damage could be because of these calluses. So what we did, we focus on education, train the trainers, educate the patients or the clients, educate the families, and educate the carers who were caring for this population or these patients because in home setting. So then we have made a program for inpatients, which is the practice-based learning, going to every patient who is admitted in our facility with the history of diabetes, checking their feet religiously, and then teaching them one-to-one basis with the help of our link nurses who were in every unit. And then these link nurses were really making things very easy for us and bringing the data back to us. What are the results? So what they have done is they have created a kit for diabetic population, teaching kit, having all the things which were required, testing with monofilament, checking their sugar on a regular basis. Obviously, that has to be done in a hospital setting, but then teaching them how important it is to check your feet on a daily basis. And once you are going for prayer, you need to, after wudu, you have to really dry your web spaces to not to have accumulation of water, which it can be the cause of fungal infection, and that can lead to further damage. So education, education, and education. Then what we have done, we use the waiting area of the patient in outpatient setting, and then we translated the leaflets or the flyers into different languages, and then hang it there into patient waiting area with the picturistic kind of thing, where they can really have a thorough idea of if they are diabetic, so what consequences they could have if they don't check their feet on a regular basis. Then after 2010, we have evaluated in 2013. Again, the same, we were doing it, starting from 2010. So we were looking into our data to see how it is going and what difference we are making. So I can tell you, like after 4 years, you can see that the proper footwear were getting into it. It was not the 100%, but at least we can see the light on the other side of the tunnel, which was very energetic and giving us energy that we are on the right path doing this. And that can one day will lead to that everybody will be into proper footwear. So these are the results from 2018 to 2020. You can see in 3 years we have screened around 5,360 patients, and you can see 757 out of this number for 3 years was improper footwear, whereas the rest all was with proper footwear, and that was quite a massive change. And then the COVID hit, and we couldn't really get the data for diabetic patients because they were not coming to hospital setting, whereas they were treating themselves at home. So I am in contact with our institution, and then see if the patients are coming back for started coming back, because it's only last month we declared that the hospital setting is free of COVID. So we need to engage them again and then see that they come to the hospital on time, and then we do the modalities or interventions, having this education and all these things properly. But having said that, it's not a one person job. It has to be team approach. Team approach to implement anything you want to do in your region or into your country or into your facility. So what was the change we have incorporated with all these? What we have done is the proper footwear. Before, when we started the program, there were no availability of proper footwear, which we talked to the policy maker, the government institution, then talking to some companies to have this is very much needed in this region. And then it's word of mouth, it was multiplying, and now I can tell you, any place you go, any mall you go, you will have one particular shop for diabetic foot patients where they can have this proper footwear. They also have the podiatrist in place who can take the measurement, see what the problem, extent of the problem is, and then to prescribe and give the proper shoe according to what the problem in their feet is. Then we have diabetic foot prevention pathway, where we can see what is which patient is low risk, high risk, or moderate risk, and we act upon the consultation and referral timing and all this according to that. Then we have published this program, and we have initiated the same program into other 7 facilities as well. So everybody speaking the same language. So we have implemented this into our electronic medical record also. So any patient comes with the history of diabetes, they have to do the diabetic foot assessment, then see what extent the problem is, and then act upon according to that. So just want to share with you, I just have these 3-year data because it's hard to pull the data from electronic medical record, go through a lot of, challenges, not challenges, actually all the approvals and all. So I'm sure I can share with you in a due time the data for another years as well. But what I have noticed is, if I look into our data, for 12, 13, and 14, I can see that the amputation rate was decreasing. And if I tell you now, I hardly see any diabetic foot patient. I can't tell you that this is we have really make a big impact, but it's just to analyze more and go into depth of this, and then see what's the problem, that we don't have any amputation except 1 or 2 in these particular years. So we really need to dig down and see what's happening and what needs to be done. But as I said before, team approach. So bring everybody on the table, have a plan which can be buy-in by everyone in your facility, the leadership involvement, the policymaker, the government institution, everyone has to play a role to overcome come with this population, saving the limbs. This was very touchy for me in the beginning when I started this program, and my heart was with this, that I can't see patient losing limbs. And this is what we have done from last 11 years, I should say. But I can see that things are really moving in the right direction into focusing on education and making your patient more aware of, because they can't see the changes. So the changes, when they can see is already the damage is done up to that extent that you can't really do anything. So we all have to work together. We share our knowledge, skill, and experience. We support each other in health as a healthcare professional, and we don't work alone. So with that, the pearl of wisdom for diabetic foot complications, that's affecting many individuals worldwide, and it's costly, and then it's losing the limbs. So to save the limbs, future direction should focus not only on promising therapeutic advances and management, but rather on prevention strategies, combining the evidence-based practices and patient-centered concerns has the potential to help us maximize ulcer-free, hospital-free, and activity-rich days, and then for our patient, and moreover to decrease amputation and life-threatening events for our future generation and population. Having said that, I'm inviting for all of you to come to Abu Dhabi and join us with our World Union of Wound Healing Congress from 1st to 5th of March. And Malaysian Association and Assian Association is one of the supporting association of World Union, and they will have their program also there on the day one. So I'm looking forward to have you all in our conference, and you can register using this website link, and then that'll be really uh, something which we are aiming for and looking forward to, that we will join all the forces together and then see how we can take care of the patient's skin when it comes to diabetic foot and all other problems into their life due to all these comorbidities. These are the references for my talk, and thank you very much again. And I would like to thank again Professor Hari Krishna for setting the standards and then really making awareness for not only for his region but globally. And this is what we need to do. Thank you very much, Professor Hari Krishna. It's an honor and pleasure to be with you. And I'm sure that we can work together on to many aspects of saving the limbs of this population who is diabetic. Thank you very much indeed. God bless you.